Okay.
Okay, cool. Hold on. Welcome to the Anatomy of Therapy. I'm Dr. John Sobolski. This week we have a very special guest, Dr. Nick Askey. He's been with us before. If you don't know him, now you know him. Nick and I worked together many years ago. He's a very dear friend, and he's got a lot of knowledge to share. Today we're going to get into treatment in the time of quarantine, and what differences that makes, how we look at things. But before we get in that, I think you wanted to kind of lay something out, Nick. Is it what would you want to tell us?
Yes. If you hear some odd noises in the background, that is my new 12-week-old puppy, Severus. He's a Cane Corso, and he has the oddest cry ever. We are not sure if it sounds like a howler monkey or a horny tomcat, but if you hear some very odd noises, that's what that is.
It's okay. We're a professional podcast. We can just edit that stuff out, but I'll prefer to leave it in. Severus sounds like a sweetheart.
Yes.
Cool. Awesome. So, yeah, we are in quarantine. You know, we're slowly easing out of quarantine. I'm not quite sure what exact phase we're in now. I know there's an easing. A lot of people are still working from home. That's the big thing, I think, right?
We're in Texas. We only have one phase, and that's full send.
Full
Just
send.
open it all up.
Let's go for it.
Let's go to the bars.
Yeah, that's how we do it in Texas. But what we wanted to get into today, a lot of people, even if they are full send, there are still some people who are still working from home, and rightly so. And, you know, maybe you're dealing with kids, but I don't know if you've noticed this, doctors listening, maybe even athletic trainers listening. I know we've got some good physios and physical therapists listening. You may have noticed a little bit of a difference in the patients that you see during this time. So what is the biggest difference in the patients you've kind of seen during this quarantine, this crazy 2020?
So we'll kind of break this up into three groups. Like the majority of my over 65 patients, I've been trying to manage them remotely if at all possible, because most of them are pretty legit at doing their exercises. And it presents it's pretty good because if I'm able to get them dialed in on the technology, you can kind of spot fall hazards in their house and kind of help them with ergonomics at home. Nice. But it also keeps them out of a potentially dangerous situation, no matter how safe you try to get your office. I would feel terrible if I was the reason that someone ended up on a ventilator if they're a high-risk patient. Yeah. Second group is your athletes. Like they're used to having strength and conditioning camp all summer and periodization of training and ramping up. And it's just like this. We go for 4 days and then someone tests positive and then we're shut down for 2 weeks and we do nothing. And then we go back and we go full send for 3 days and then we're shut back down. So it's very erratic and unpredictable. And then just your work from home patients, the ones that I see that have the most trouble are the ones that are used to moving around a lot more and having really good ergonomics, and then they're at home. So we can kind of break those 2 to 3 populations out. I don't think there's too much to discuss on the over 65, but I think if we unpack the athletes and then the work from home populations, I think that we'll discover some pretty interesting trends of BC before COVID versus in COVID injury, because I've seen some different injuries and different frequencies of injuries pop up that are not typical, that I haven't seen at this frequency in my 10 and a half years of treating.
So let's just start with the at-home kind of work people. What are the kind of differences in the injuries you're seeing with, you know, it's general population, they're now working from home. What are you noticing?
I've seen more cervical radiculopathy in the past 3 months than my entire career. Just tons. And I think that it's a perfect storm of people not moving around, they're Netflix marathoning, they're bent over helping their kids with their schoolwork. They're grinding their teeth at night because they're stressed about paying their bills. They're not sleeping very well. They're emotionally, financially stressed. A lot of people, like drug reps and teachers, they're used to putting on 25,000 steps a day, and they may get 1,500 when they're working from home. And you got some people that they're used to having a $2,000 office chair and a sit to stand ergonomic station and monitor. adjustable monitors, and they're sitting in a folding camping chair next to a card table on their laptop like this, and it just takes its toll over time.
Okay, so I'm gonna play devil's advocate. You know, I know the answer to this, but okay, but it's more comfortable at home. It's less stress at home. Why is it? Why is there less stress at home and I'm getting injured?
It's not less stress at home. It's less stress at home when you're not working at home. But when you remove that work life balance, and it's just work is at home and home is at work, and it just muddies the boundaries, then you don't know how to take your work hat off and stop checking work email and shut your work computer, and just go, okay, now it's family time. I know that some of my patients have really enjoyed more family time, to where they go on walks and bike rides with their family, and they're able to have dinner together. They have more time to cook because they're not going out to eat, because they're not rushing to sports practices here and there and everywhere. But there's some people that it's just they're in the same situation. They're not able to socialize with their coworkers. It's just you're in the same lane all the time.
Right. I mean, legitimately, patients will ask the question, I didn't do anything. Why am I hurting? And then they'll proceed
That's
to,
why.
I know. They'll proceed to, even like I had a woman today, cervical radiculopathy, by the way. And she, in her history, talked about how she was hurting. And then she went to help her parents move and do a bunch of stuff. And she's like, and my pain went away for 4 days after I got active. And I was, it wasn't long days, but I was working maybe 6 hours a day, kind of moving stuff from their garage. And I didn't have any neck pain anymore. Like,
Weird.
Your first one was good, but why is that?
So in general, like, unless somebody's totally overloading like overhead movement, like, in general, necks thrive on movement, because if you're moving your upper extremity in highly variable patterns, you're flossing all the nerve roots of the brachial plexus. You're changing your neck position so you aren't falling victim to postural creep. You're not putting tons of just low intensity, long duration load through all of the stabilizers in the neck, because you're constantly moving. So you're able to recruit more of the accessory muscles to stabilize your head. You're just, in general, necks feel better when you're moving.
For sure. Absolutely. You said, so the other one you noticed were, let's just stick with the kind of stay at homes, some lumbar stuff. What particularly have you noticed with low back pain?
Tons of like lumbar radiculopathy, and just sciatic like presentations, because people are just sitting more. They're not getting their activity. And a lot of people, like myself included, if you take the gym away from me, like, I'm going to have a really hard time keeping my back feeling good, because my back thrives on movement. I need to deadlift at least twice a week, pretty heavy, for my back to feel good. And if I sit for a long period of time, I know I'm going to have to dig out of a hole, because my back is going to feel like warmed up garbage. And so, in a lot of these people, they rely on these fancy ergonomic chairs and back supports. The only saving grace is you're cutting people's commute out, because if they do have a long commute, some of those people do feel better because they're not trapped in a car for 2 hours a day. But if you look at the general workflow, when you are in a large office, you may work for 30 minutes, and then you got to go down the hall to a meeting, and then you got to go get something off the printer, and then you got to go to the water cooler and chat it up and stand for a little bit, and then you got to go to the bathroom. Where some of these people, they're able to just hammer down for 5 or 6 hours and maybe get up to pee once, and they're not sitting in a good chair. They don't have the super ritzy work from home setup with adjustable monitors, and they're just staring at this laptop screen. They're probably sitting on their couch, and they're just not getting good variety of movement.
Okay, I'm stuck at home now. Let's just kind of follow up. What do you give advice for at-home workstations? I mean, people are like, where any tips for working at home?
So all my patients that are working from home, I measure them on the height that they need for a standing workstation.
Mm.
So I just have them stand up, relax their shoulders, bend their elbows at 90 degrees. And I take my measuring tape that I use for measuring calves and ankles for braces. And I measure 1.5 inches below where their elbows hit their sides.
Mm.
So that gives them a nice downward angle for good ergonomics with their wrists. They're not going to have Tommy Boy shoulders, and they're not going to be like leaning because it's too low.
Mm-hmm.
So then they can go home and go, okay, my kitchen counter is 6 inches too high. So I'm going to go and shim this up and stand on this and then put a little mat on there. So then that's my standing workstation. So I tell people like, okay, work for a couple hours in the chair and then work for an hour standing and just try and gradually ramp up your standing work. So you can
Right.
at least get some movement in there. And depending on the person's orthopedic situation, I'm like, okay, every hour do 15 squats. Or like a couple toe touches just to get some movement in the spine. I'm like, it doesn't have to be fancy. Just do something that you weren't doing that caused your back to hurt.
Right. That almost leads me into, because I've got this question so much, and I feel like I can give this answer to patients, but I almost don't want to, because then they'll be like, all right, well, what's the best home workout? And I'm like, the one you're not doing, or the one you do consistently. But my question to you, I'm sure people have asked you this, like, maybe I don't have any weights, maybe I've got some fives at home. What do I do to work out at home, Dr. Askey?
So if I have someone who's deconditioned, and that's another thing that people are just wrecking themselves, like the gyms are closed, so then they go pull their pink Nike Frees out of the closet that are 5 years old and run like a baby elephant, and they wonder why their knees and their feet hurt. If they're deconditioned, I make sure they have some good shoes, and I tell people like walking is the best thing that you can do. Like, go walk, listen to some podcasts like Your Glorious podcast, or download some audiobooks, learn something. Like Nietzsche produced some of his best work walking because he had intractable migraines and he couldn't sit. So some of his most famous stuff he wrote when he was walking. So in some of the greatest thinkers did their best work when they were walking. And so it has kind of gotten like stigmatized as an old person's exercise or people with a dog's exercise. But I do like seeing people out on the trails more and getting some vitamin D and getting outside and exercising in a low risk environment. I'm like, go walk. And if the person has a little bit higher fitness level and they have some dumbbells or some weights or some kettlebells, I'm like, do some weighted carries. Like, take that weight on your walk with you. If you have a weighted vest, wear that to walk. If you have a backpack, put some weight in the backpack and go for a walk. And then if you're proficient at running and you've kind of passed the test that I know it's safe for you to go run, like we'll give you like a couch to 5K, but not a couch to hospital or couch to my table program, and kind of build up on intervals.
Yeah.
And the home workout equipment has been just insanely hard to get a hold of. People are just price gouging. They're hoarding. They're buying new dumbbells and they're selling them for $3 a pound. And I'm like, it's not steak, it's a dumbbell. Like, so I don't encourage people to just go, oh, I've never trained before. And then I tell them to go out and buy stuff that they're probably not going to use.
Right.
But in general, you can do a lot with body weight. My people that travel a lot in non-quarantine times, I gear them more towards like a TRX because that's super portable. They can throw it in their business luggage. They can hang it over the door in the hotel, and they're not dependent on a hotel gym. It doesn't, and I'm very reluctant to give people stuff that takes up a ton of space to where if they don't use it, their spouse is going to be on them for getting it out of the house and selling it, and then they're always going to remember who told them to buy it. And so I do love kettlebells because they take up as much floor space as like a small trash can, and they're super versatile. And to where anything you could do with a barbell, you can do with a kettlebell, and you don't need a squat rack. You don't need a ton of space. You can do snatches, presses, get ups, carries. And there's a lot of things that you can do with a kettlebell, and it's got a very small footprint.
Have you seen anybody say that they've tried any particular like home workout, home exercise, and then ended up in your office? Have you noticed any trends with that?
I did see a lot of trends with people like pulling out their old insanity like programs, because that's extremely high in plyometric. Like I see a lot of like plantar fasciitis, Achilles tendinopathy, a lot of gastroc problems if people are not warming up properly, or if they're just going out of the gate to where they haven't done anything and they're on a mission to lose 9 pounds in a day, and they're gonna do insanity every day, twice a day. But in general, like I've had pretty good luck with people doing like yoga videos at home, and just in general, just a lot of people have signed up for like Beachbody, and I haven't seen a lot of those people in my office. A lot of them are just there because they're doing too little, or they're just trying to run and they're not biomechanically or movement pattern ready to run yet.
Right. No, I've noticed that too. As well, we can kind of transition it over into athletes with this, because I have had a couple CrossFit people, old patients, CrossFit people come back. Their boxes are now opening, and I have noticed that those calves get locked up, the gastrocs get tenderness in the Achilles, maybe a little plantar fasciitis jumps up. But do you think that is just because they went from volume of nil to, a CrossFit workout, just jump back into with the athletes? What is the common thing you've noticed with some of the athletes jumping back into working out?
Yeah, I do think that a lot of it is they get excited puppy syndrome, and they're like, I'm back in the gym, and they just kind of like ignore the warm up and just kind of go through the paces. And like if they haven't gotten into end range dorsiflexion in months, and then they have to squat and do double unders and run, that calf is tonically just locked up.
Right.
And a lot of people, like, it's been a while since they put on shoes. So like just getting used to moving without having full awareness of the ground is going to tone everything up as well.
For sure. We kind of skipped a little bit of the treatment with the deconditioned people. We're giving them ideas of what to do with those deconditioned people. How much of it's obviously patient to patient based. Just trying to think about what these doctors would be thinking. How much, because I've noticed this a lot more recently, going back to the average at home worker, a lot of just bad soft tissue, man. Like putting my hands on people and just feeling not good soft tissue, and getting away with like, I need you to foam roll 18 times tomorrow. Have you noticed that as well? Like, what are some of the more kind of more specifics in treatment with those at home workers that you've noticed?
So if I'm feeling like a systemic bad soft tissue problem to where it's like, to where I can poke on shoulder, back, quad, like shin, and it just feels like just bad quality tissue, I'm like, all right, you need to drink some water. Because dehydrated tissue is not going to be at the quality of hydrated tissue. I also put people on magnesium glycinate if they're just all toned up all the time, because you do need magnesium to act as a muscle relaxer. Most people get enough calcium in their diet, and that is needed to contract the muscle. But in general, if we're talking like extracellular fluid, 85% of the general US population is deficient in magnesium, and magnesium glycinate is the chelated form that more targets like the soft tissue piece. Like magnesium citrate is what they give you to like totally blow out the pipes for a colonoscopy. And then there's other forms that are more for like brain function and stuff like that. But magnesium's a big thing. And then I try to set reasonable expectations with these people. I'm like, this is like breaking in a baseball glove that got left out in the rain for 2 years. Like, you just need to put some oil on it and go play catch with that thing every day and not miss a day, and make sure you don't leave it out in the rain another day, because then we lose progress. And if they have that expectation of it being a methodical and consistent process, and not like I'm going to get something to pop and then I'm going to have all my movement, they're a little bit more primed to not getting discouraged. And then helping them celebrate small victories, and you can be the bridge to that person being more active. Like, I just tell people, I'm like, this rehab is going to make you sweat, and it's going to get you moving. It's going to expose your weaknesses, but it's also going to motivate you to work out, because it's going to get you feeling better, to where it's going to kind of bridge the gap between you feeling like you're on an island and you can't work out, and therefore you have told yourself that you can't lose weight. And then you are getting them feeling better, and they're like, hey, I went up those 10 steps and didn't get winded and my knee didn't hurt. So then they get ideas of like, okay, I'm going to use this as kind of a bridge to, you're kind of blending the rehab with their workout now. So it's a very unique and kind of an awesome opportunity, because you can help change that whole person's outlook on how they perceive pain, how they perceive exercise, and kind of teach them how to be their own advocate and empower them to control their own health, so they don't feel like they have to just lay on a table like meat with eyes and just rely on manual therapy and someone Miyagiing their soft tissues into place. Because there's a lot of people that are greedy that will create that kind of context and that dependence on the passive treatment. And I think that's what gets Meekins and all these anti-manual therapy people so fired up, is you're not empowering your patient. You're not getting them stronger. You're not giving them active rehab. But if you put those two together, it's just like pouring accelerant on the fire. Like, the fire's still going to burn, but you're speeding up the process.
For sure. No, and those are really important in these days, because I've seen so many more deconditioned patients, and I have to like, well, you know, the way that I treat, like, I want to fix you. I want to blink, cross my arms, and then have you fixed just because of something magical I did. And I've got some tricks, but I feel like during this time I've had to dial them back and have this come to Jesus meeting and be like, look, I could pull out all the tricks today. You've got this, you know, like you said, deconditioned tissue for head to toe, and I'm just not going to be able to crack this open, and then you're going to be set free like a genie in a bottle. Like, this is going to take some rubbing on your part as well. But anyways, so communicating with the patients, a lot of those people that, you know, maybe I was fixing a little bit quicker, we're trying to give them more reasonable expectations. We're trying to give them a good thing to go at home, work on stuff, get back to life. Athletes, this is the fun part. They're all jumping into the deep end. They missed it. They remembered how their clean and jerk was, and then they jump right back into it. How do you, I mean, we're obviously thinking about tempering expectations, but like, I'd be interested to know where you throw them in with their rehab, because you and I can give complicated rehab or simple rehab or the right rehab. You know what I mean? And we've learned these things over the years. And I do think, especially with these athletes, they almost want the complicated rehab. And sometimes by me giving them a more simple rehab, they kind of have to readjust their notion of their injury or their ability in that injury. And so giving them a more simplified rehab that is challenging to them seems to kind of tone them down a little bit. How do you kind of approach some of these? I mean, maybe I know you treat some higher level athletes, but where do you look with these athletes and their kind of the rehab at least?
And this is what I think Steve is really good at, Offenberger. A lot of his rehab is very simple. It's like, all right, let's clear the sagittal plane. Let's see if you can move a acetabulum on a femur and a femur on an acetabulum.
Right.
And the rehab is very simple at surface look, but it's very complex with what the goals are. But the patient doesn't really have to understand the goals as much as you do as the doctor. Otherwise, you're just throwing crap at the wall. But if your rehab is simple, but it's challenging, the exercise can be the test and the test can be the exercise. And what I'm explaining to people is I have this conversation on a lot of last visits. I'm like, okay, like when you're foam rolling through something, you don't have to arbitrarily foam roll for 2 minutes. Like do 3-4 passes. If you don't feel anything, move on to the next muscle. It's more of a screen and a scan at that point. Right. If you're getting in the wall stretch, line up on the wall stretch, and if you don't feel it is tight and locked up, then hold it for 10 seconds and move on to the other side and check it. So it just gets more efficient. And if the athlete knows that, okay, this is kind of my check myself before I wreck myself kind of thing, then they're going to be more inclined to kind of keep that in their arsenal versus something that has 19 steps and they're going to forget it. And it may be very specific in context to exactly what they're dealing with in that point in time versus clearing out an entire plane of movement, which is what they need all the time.
True. And that's back to setting the expectations the right way. Absolutely. So so let's go back to treating these athletes. Patterns that we are noticing with treating athletes. Is it strictly just the volume leap, or have you noticed anything else?
So let's talk first about like middle school, high school athletes, to where they're used to being in strength and conditioning camp all summer, to where they go in like 2-a-days in football should be starting in like 4 days. But they're not starting in Texas football period until like September 7th. So these kids are used to just being with their coaches and their teammates daily. And the coaches, if they have daily access to their athletes, they're going to go, okay, I really beat them up yesterday, so we're going to kind of have an easy day. And then we're going to hit it hard. And we did deadlift and power clean in the weight room yesterday, so we're going to do some upper body stuff. So they have a plan and it's all mapped out. But if they have athletes for 4 days and then they lose them for 2 weeks, they don't know what these kids are doing on their own. They're probably playing Call of Duty and sitting on their beanbag and doing nothing. And then the kids are just straight back to where you have this very heterogeneous level of conditioning versus if you got all these kids in front of you all the time, you become more of a homogenous group. Like right. Guys, when they start basic training in the military, are very different at the start, and then they start to look a lot more the same because they're getting this homogenous beat down and it's periodized and it's controlled versus this being the most chaotic, uncontrolled bit of training. So that just lends itself to injuries because you go from like 1,000,000 miles an hour to nothing.
Right. So are you trying to tell these athletes to, have some level of consistency if they're not, say, in practice or, nobody's doing camps actually, right? There aren't any camps. There's some summer camps kids are going to, but not any athletic camps at all.
And this has been the easiest time in my career managing athletes because it's the longest off season ever. And I tell people, like, if they're in my office, they're nursing an injury, and if they can't go to camp or practice, like, we use this as a very strategic deload period, but we do active rest to where it's like, okay, this is when you can work on, like, this may be a hamstring, but that ankle doesn't move, and it hasn't moved since you sprained it, and I treated it 2 years ago and you stopped doing your exercises. So we need to clean up all these weaknesses and use this as kind of spring cleaning time to get some of this stuff knocked out, because you don't have anything to do. You just told me you watched everything on Disney Plus. So you don't have anything to do. You've got nothing but time. If you let me fill that time with productive rehab, that I may not overload you with that much rehab if you were in season and you were in school, but we just treat that like our training to maintain some consistency, then you're in a better place when you're allowed to come back after that 2-week quarantine period. And then you may have 4 more days before they sit you on the bench.
Right. Have you noticed the opposite? The quarantine transformation person, athlete or a real person who's been like getting after it. Have you noticed any of those?
Yeah. I've had some athletes that are just working with private trainers one-on-one. They're feeling good. And I've had some people that have taken this the way that we all need to take it, because they look at people that have all these underlying conditions, and COVID is being like the most naturally selective process in recent history. And if you're surviving on pharmaceutical life support and you're on metformin and Lipitor and lisinopril and Cymbalta, and that is allowing you to like keep your nose above the water so that you can survive, like COVID's going to put some concrete shoes on you and dunk you under the water. And so some people are taking this very seriously and using fear as a motivator. And they're like, hey, I need to get my blood pressure under control. They start walking, they buy a Peloton, and they just take it very seriously just due to fear, because I've had a lot of patients lose parents to this, and it's just crushing, because I hate to see them hurt, but they're taking it very seriously because that hits home, to where they're taking their health into their own hands, because they realize that if you have this very passive strategy and you expect people to just take care of you, whether it's the government or your doctor or big pharma, it hasn't worked out well for people that have had that strategy the last 10 years.
Yeah. No, I've heard one of the best explanations I've heard with this. It was an economic explanation, was that that COVID is an accelerator. They were talking about people moving out of big cities and stuff like that. Like, you know, if you moved out of New York City, you were probably going to move out of New York City in the next 3 to 5 years anyway. Same thing with San Francisco, or think about Rogan in LA or something, like coming to Texas. Like, that was probably going to happen, but it's just kind of accelerated. There are these people who are like, I need to get fit, I need to get in shape, and they're kind of using this as their accelerator. I've got a couple that have come in, they've like together lost something like 80 pounds together, like 40, like really good stuff. And we're dealing with injuries on that side. You know, they're exposing some of their weaknesses and they're still moving and they're good. Have you treating patients in terms of the transformation? What have you seen?
I have a lot of people biking more. You look at the bike aisle in Dick's or Academy, and it looks like the toilet paper aisle. But basically treating these people like you will have problems whether you gain weight super rapidly or lose weight super rapidly. So you're just changing the way your spine is bearing load, in the way your pelvis orients in space, and whether your brain thinks you're falling forward or backwards if you lose your belly. So that presents its own unique challenges. I see that after people deliver children, after people get gastric bypass, if people are just on a mission to lose a bunch of weight, and you have the volume on top of the body just going, whoa, like you're 20 pounds lighter. What's going on? And some people are just under fueling. They're in too much of a caloric deficiency for their amount of activity because they're just on a mission. It's like, hey, your soft tissues are protein and vitamin C. You need both, or you're going to have some problems and stuff is going to break down.
And that, yeah, I'm noticing that, it's a weird case of injuries though, like that. I've just seen more and more recently. Like I'm down 20 pounds, I'm up 10K steps a day, and all this stuff, but now I'm injured in this little tiny way. Have you? Okay, you've talked a little bit too about the nutritional thing, like water, right? Like because then they'll expose some of these soft tissue injuries, and they're also very willing to go after it. Um, I love seeing those patients. These are the good ones, right?
Mm-hmm. They're they're kind of refreshing to be around because
Yeah.
they kind of motivate you to kind of reflect and go, okay, am I as motivated as this person? And
Right.
it's just fun to be around those people because they project positive energy because they're heading in the direction of their goals and where they want to be. And you just kind of have to be their Sherpa and go, okay, I'm not going to let you hurt yourself on your way to your goal because there is a speed limit on this and there is a reasonable pace for this to happen. And I don't want you to get discouraged by breaking the speed limit and hitting a guardrail, and then you're dealing with an injury that sidelines you, and then you just eat hot Cheetos on a beanbag and gain all your weight back.
Right. No, that's awesome. COVID injuries, man. What else? This is why I want to break from the patients for 1 second.
Mm-hmm.
You got a sauna, and I haven't. I think the last time I saw you, you were just like installing it or something. You had to get your electricity changed and everything. It was a
Mm-hmm.
real commitment. How's the sauna life?
It's awesome, man. I've been doing it every day. Sometimes I'll miss like a Monday because of the way the gym schedule goes with my patient schedule. And it's hard when I get home at 7 and I got notes to do and just to get in the sauna right before I go to sleep. But I've been doing it every day. My sauna, it takes the 220 electricity. So I had an electrician run that. It has to be run directly from the main breaker. So they couldn't run it from the breaker in the garage or it would like dim all my lights when it turns on.
Yeah.
Um, so I got one of the traditional like Finnish saunas. It's not an infrared sauna. So it's got the heater in there that gets it up to about 200 degrees. So like before I go for a run, I turn it on because it takes about 40 minutes to get up to that 200 degrees. Been experimenting with different kinds of steam because it came with like a big bucket and a big ladle. So I've been putting like some eucalyptus and some birch oil,
Oh, nice.
some tea tree oil, some like orange oil in there just to kind of clear out the sinuses and wake me up for the start of the day. And then I'll do the sauna for like I go in there with a huge cup of water because I go in there while I'm sweating from a run to where I just got back to where I've got my heart rate up, I got my core body temperature up. So it's like that sauna just like boosts me to where it's like, okay, you're already halfway there. Now we're going to accelerate your heart rate and vasodilate more to where your heart has to work harder to cool your body off. So it is essentially doubling my cardiac workout by doing it after a run.
Right.
And then it will spike your growth hormone by like 200%. So that's good at maintaining muscle mass if I'm running more. And then I just set a 20-minute timer or 22-minute timer on my watch because my phone overheats in there. Um, and then I've been doing some of just the 6-second nasal breathing, inhale, exhale, and then just pour some steam on there, and that will like increase the temperature by like 15 degrees. Like you feel it get super hot on your neck. But listen to some podcasts and books in there. And then as soon as I'm done, I jump out and I jump in the coldest shower that I can get in South Texas in July.
Right.
But then I sit in the cold shower for like 5 or 6 minutes and just like let it run over like the back of my head and in kind of upper traps area, just to kind of get that neurologic reflex and get cooled down. And you get in a super euphoric state for like 10 to 15 minutes after that, to where like if you're going to meditate, that would be the time to meditate because you could go super deep.
Interesting. That's where you're connecting with that. But you go and you play with your new puppy. Really, that's what you do.
Yeah.
Nice. What books have you been reading, man? Would you or have you read any good books that you might recommend to specifically doctors? We got some good physios over in Europe that you would recommend. Yeah. What books would you recommend?
So I just finished Kevin Hart's book, Decision. It's a little
Nice.
off topic, but it was a good short read. It was super quick. It's an Audible exclusive, so it's only in audiobook. Just got some good, like, just actionable concepts in there. It's just kind of like put your head down, do your work, be positive, love each other. It's just a good, like, morale booster during all of this. I'm reading, I just finished a book on the 1918 flu pandemic, and it was just really crazy to see, like, all the parallels between scientists and the scientists telling the military they need to do something, and then they do the opposite, and then all this stuff happens. So it's like, okay, we're not much different than we were 100 years ago.
Yeah.
I just wanted to learn more about that and just kind of how that ended up fizzling out, which was it kind of was hopeful, but kind of not, that it just kind of like mutated into a less virulent form after the fourth peak and it just went away. Um, and then I'm reading James Nestor's book, Breathe.
Oh, right.
So a lot of the comprehensive breath work, a lot of nasal breathing stuff, talks a lot about everything from the stuff that, I don't know if you read that book, Jaws. It's all about, like, mouth breathing and soft foods changing the architecture of our jaw and our face and skull. It was an orthodontist and like a anthropologist wrote it, and it just shows all of these, like, crazy things that happen if you plug the nose of a monkey. Its jaw will retract into, like, no chin in 2 weeks.
Wow. I saw some of the clips off of him on Rogan talking about how if you plugged, they did a study, they didn't even do funding for it, but they plugged his own nose, and then
Yeah.
over the course of 4 weeks, like the elongation of the face and the falling
It was
back of the
only 2 weeks,
2 weeks.
and his blood pressure went up like 20 points in 2 weeks, and his HRV just tanked. In like, he got a sinus infection. So it's almost one of those paradoxes. It's like, if you're stuffed up and you stop breathing through your nose, you're going to get more stuffed up and it's going to get infected, and then you're going to breathe through your mouth more.
Yeah, man, I know that Bobby read that book, Jaws, and he loves this stuff. I know he's all over Nestor stuff, so prayers for Bobby right now. But Bobby's fine right now. He's just on vacation. But he got me to do one thing from that Nestor book, which was putting the tape on the lips.
Yeah, that was from Oxygen Advantage.
That's right. Yeah. Game changer. Like, I thought I slept well, and I do sleep well. I put the tape on my lips. Holy crow, I sleep so much better.
Yeah, it's interesting. Just because I had sinus surgery when I was 15, so I've always had bad sinuses, and that, I thought that was going to make me freak out, but it does feel pretty good once you get used to breathing through your nose.
I have to do it when I get a little bit sleepy and, like, relaxed. If I do it too much before, you get a little shifty. It also, your wife will make fun of you.
Yeah.
But that's kind of a normal thing, because I'm pretty
Yeah,
used to
that's
that.
par for the course for me.
Yeah, we're pretty calloused on that angle, so you're just gonna take that. But yeah, breathing stuff. That's awesome. So wait, what were the books again? They were Nestor's, the flu one,
And then Decision by Kevin Hart.
Kevin Hart. Man, he's such a workhorse, though.
Yeah.
That dude is like a serious workhorse. Awesome. Speaking of workhorse, Dr. Askey, if y'all don't know him, is himself a workhorse. Are there any particular strategies in practice? Because some of us don't have as busy a practice as Dr. Askey, and we have a couple of patients which we are cherishing and taking very good care of, I imagine. But if you were in a position where you had a little bit of free time, and I know you did at one point through all of this, like, are there any particular habits or rituals that you put into practice during this time that helped you?
I when I was like when I had some extra time, like back in like the scorched earth start of early April, when everyone was buying TP and like thinking the world was going to end like right then, um, I went back to the way that I practiced early on, to where like if I had any extra time, I was on Google Scholar looking up articles. I was writing in my like field notes book of anything that confused me from any patient I could recall that I didn't have time to do before. And I was just researching those cases, just because if my brain gets idle, I'm going to get really in a dark place to where I'm just going to be like, okay, I don't really want to be here. Like, this is like, what am I doing wrong? Like, and then I get in my own head. But if I occupy my mind, like by jingling keys, like researching clinical stuff, and another thing is I'll have a clinical book at the office along with some journal articles. But just like if you're on like a super long plane ride, you get fatigued to where it's like you can only listen to so much clinical before you'll dive into some philosophy stuff or some different things, to where I'll have like a non-clinical book. Like I'm reading a book right now called Running with Sherman. And it's the same dude that wrote Born to Run and Natural Born Heroes. In like he decides to like adopt this donkey that was like in an animal hoarder's barn, and like he takes him on these burro races.
Chris McDougall? Is that who
Yeah.
that?
Yeah.
Yeah. Cool.
So
Awesome.
stuff that's different, to where it's like, okay, I'm still kind of learning something, and it's not super like to where it's going to let my brain go to mush, but it's not like I'm reading a peer-reviewed research article or a textbook or something that's super clinical. You need to give your brain some of that variety, and then just having a system to where you're like, okay, I have a checklist of like, if I have any downtime, I'm going to do this, and then I'm going to do this, and then I'm going to do this. And I have this system that's always in my head, to where if I have 15 minutes, I'm going to knock out all that stuff that I would have to do at the end of the day. So then I can enjoy more time with my wife and Severus at the end of the day. And I don't have to do all of that until 8 at night.
Right. And I heard a really good quote talking about if you're not disciplined and you don't set limits, then don't be surprised if you never feel limitless. Because if you do set those limits for yourself and you can stay within those limits and then accomplish those things upon that checklist, after you've done all those things, after that, that's the limitless thing. You're like, I checked all the boxes. I get to hang out with my wife and my new dog, and I get to have a nice little evening in the sauna.
And another thing like that I picked up from James Allen's book, Getting Things Done, is like when stuff pops up, because there's so much like busy work that has popped up out of this, and I think everybody's life, because there's no barrier to someone setting up a Zoom meeting to make you attend. Is I've gotten better at, like, if something takes less than 2 minutes, I just do it then. I don't take the time to put it on a to-do list. I just do it. And then I don't have that anxiety of multiple spinning plates and just things getting stacked on my to-do list. And then also just, I've gotten a lot better at saying no to stuff that I would normally just be like, I very rarely said no to people before this, but I've learned a lot about myself during this time, to where it's like, okay, I can't always say yes to everybody, or I'm going to just be saying no to myself all the time. So
what have you said no to?
Just some like meetings that I look and I go, okay, this is redundant, to where I don't need to be in there. And I look at the commitment and I'm like, this is going to take 3 hours of my time. And I don't know why I'm here. I don't know if this is just to have another Brady Bunch square on the Zoom meeting or if they want me to like basically say what my opinion is on something, send me the transcript or send me the email and I'll put my 2 cents in, but I'm not going to sit in a meeting. That's why I became a clinician, because I hate meetings. I've just like stepped back versus always saying yes, because it's in my nature to just kind of be the hard worker and go the extra mile and just say yes to everybody. But I was getting super stressed and getting burnt out and getting moody. And like, I'm just like, okay, I need to get better at just like being okay with saying no when it isn't part of like, if I don't see the value of me being there and I don't think it's necessary for me to like contribute to a project, I'm just going to say no. And I forget who said it. It was one of Ferris's people that he interviews. He's like, if it's not a hell yes, it's a no.
That's a good one, man. I like that. I like the discipline to say no, the discipline to do your checklist. If you got to get it done, just do it then, especially if it takes 2 minutes. You're like, I could do that later, or you could do it now and just get it over with as well. I mean, those things are super smart. If you're working for yourself, especially, you got to set those limits. You know, they say there's the corporate end of rebel and the rebel end of corporate. And you got to fall somewhere in between. You can't be so strict that you're not a rebel at all and you don't find a time to break out and improve and read some of those new things. But at the same time, you got to set those limits so you can break out. Anyways.
Yeah.
Cool, man. Let's polish this off with something fun. How do we
Okay.
polish this off with something fun?
I don't know, man.
Me neither.
I could bring Severus in and we could put him on the camera.
That's going to be a blast. I got cats wandering around here all over the place, so I feel like we could have a little animal war. Yeah. Let me say this. So you have been reading some good clinical stuff. I know we both kind of we love kind of the little gems, but I think the big abstract stuff and then the small specific stuff get really fun for us. If you had to, as a doctor, kind of improve over one thing, or let's just say, for those of you guys that don't know, Dr. Askey is in contact with a lot of other doctors at the company we work for. And so you've kind of got a interesting window, a glimpse into a way that a lot of other doctors think, more than a lot of people do. It's kind of a rare situation that you're in. What are you seeing with any of those trends in the doctors that you kind of talk with? And, you know, what advice would you give them, or have you given them?
I think that the biggest trend is people want the tricks before they know the basics. And in like, I built my foundation on anatomy and biomechanics because the doctor who taught me in clinic has his master's in anatomy. So he just boils everything down to anatomy. Mm-hmm. And then one of my mentors in school, who I interned with, like outside of the student clinic, he was like a biomechanics ninja. So I just put those two together. But I think that if you don't have that foundation, you're just kind of like doing the exam that people have told you need to do. And you're like going through the tabs. And then you're doing the latest exercise that you saw on Instagram or that your friend told you about. Or like I see some doctors that I show them an exercise and I explain why this exercise works. And then they're giving it to everybody, whether they have a migraine or a big toe problem. And I'm like, no, like you have to know why this works and like why you're selecting this, because otherwise you're just giving something to somebody to keep them busy, or they could hurt themselves. So a lot of it is, I think that people need to think about having an Occam's razor approach to treating and rehab. Less is more, simplest solution is the best solution. And just going, okay, how can I be creative and kind of paint this picture of how can I give somebody the least amount of exercises to do and have the most benefit?
Right.
because it's easy to throw a bunch of stuff at the wall and Uzi something, but having that sniper mindset of like, okay, I'm going to corner this thing with a good exam, and then I'm going to treat a couple things and retest, and I'll treat a couple more and retest. And then the whole time I'm treating, I'm talking to the person, but I'm also thinking of how I'm going to orchestrate 3 to 4 exercises to surround this thing and evict it from their body.
Right. I mean, I think that kind of goes back to what we were talking about. And you can go back a couple episodes, by the way, to our friend Dr. Offenberger's episode, where he kind of goes into some of those simple exercises with some more complicated baselines. That's kind of the best, I would say, example of what Nick is talking about here with Occam's razor, and being consistent with those sort of things. Yeah.
Yeah, and if you find that you're lost, just think like, okay, what plane is this person really having trouble accessing, or where do they live and where did they get hurt? If you have a rotational athlete and their toe touch looks good, they got pain-free extension, their lateral bend looks fine, but they always get hurt playing tennis, you should probably build your rehab around the transverse plane. It doesn't
Right.
always have to go sagittal if it doesn't look like garbage.
Right. No, that's true. That's funny you say that with the exercises that you've given doctors. I literally have talked and found a good exercise or something, and someone's asked me about a patient, and I'll show them a rehab exercise, and then I'll see that doctor years later, and they'll go, "Oh man, I'm still giving that one exercise," and I'm like, "For what? For
Yeah.
for that one? You see that same injury still?" But yeah, I mean, like there are good exercises, but if you can see the impetus behind it, I think that's a really good way to start thinking about things in different planes. I mean, like the sagittal plane is a massive one that people need to be good at, of course. But some of those more nuanced ones, if you see where your patient is injured, and they're injured in the frontal plane, or they're provoked in the frontal plane, your rehab should entail something in the frontal plane. No.
Yeah, and like I'm a huge nerd, but like if I think of an exercise that I'm like, oh, that'll hit all 3 of these things, like it kind of makes me excited to where I'm
Yeah.
like, oh, I can't wait to show this person this exercise,
Right.
because like I can explain it like to where, okay, you remember this, and this on this exam, this will fix all 3 of them.
Yeah.
So you only had 5 things wrong on your whole exam, and we knock out 3 of them with you doing this for 90 seconds. And
Yeah.
so they're like, oh, that's awesome. I'm going to do that because that's a 3-for-1 special.
Right. No, dude, those are the best. Whenever like you during while I'm treating them, in the beginning I have something in my mind probably, but as I go, sometimes I'll refine it. And maybe like with 10 minutes left in the visit, I'll finally like it'll click or something and I'll get so excited. I'll be like, "Oh man, I've got this real simple thing. You're going to go buy a slant board when you go home and you're going to love it."
Yeah.
But yeah. Have you been on
So
that slant board lately? I know you're a slant board. Let's do slant boards and then let's close this down real quick because
okay.
I've been back on my slant board, loving
I
life.
I have a bar height table that I do my notes on when I get home, and the
Yeah,
slant board's right there. So I stand on the slant board and do my notes
boom.
all the
Okay,
time.
so the slant board is an old rehab classic. You can see it in classic PT physio uh, rehab stations everywhere, right?
Mm-hmm.
What so primarily when we think slant board, people go it's to stretch your calves, and it absolutely is, but it's so much more.
Yeah.
Beyond stretching calves, what do you see the slant board doing?
So with and I give this stretch a lot with like a half roller, to where people put their feet on it and then they have to like open their hips up and squeeze their glutes. So I explain it to it. I explain it to patients. I'm like, calling this a calf stretch is like calling the Bible a book. It's like it's way more complex than that. And I explain it to people easier by explaining the converse of like, okay, if you're in high heels and you're standing, your pelvis is going to dump into J-Lo. Your quads are going to be on, hip flexors are going to be on, calves are going to be on, core is going to be off, butt is going to be off. So if we can teach you how to stand the opposite with low heels and open your hips up, calves are off, quads are off, hip flexors are off, butt is on, core is on, and you are using all the muscles that you're supposed to hold your body up in space.
Right.
Versus those people that always have a vastus lateralis that feels like it's got a baseball in it halfway between the hip and the knee.
Right.
Those people are basically holding themselves up in space and getting proprioception from their vastus lateralis to keep them from falling forward on their face.
It's true. Have you noticed real quickly? I'm not done with this slant board. That's basically the perfect way to say it. I feel like a lot of people don't realize the connection between the hips and the slant board, because every time someone gets on, let's just say even the half foam roller, you'll see that butt just kind of jut back out and they'll go into that hip flexion, extended spine, right?
Mm-hmm.
But quad injuries, man, have you noticed a jump in quad injuries at all?
Yep.
And is this the reason?
I think this is the part of the reason why we have these quad injuries is you got all these people that are sitting at home. They're not training as much, so they're not foam rolling their quads. They're not getting on the floor to stretch out their hips. And in general, like my quads will get tight the more that I sit.
Right.
And if you got people that are just priming the system to have tight quads, tight hip flexors, then they perpetuate the problem with a faulty feedback loop when they're standing and walking.
Mm.
Because if you have an anterior tilt of the pelvis, the EMG activity in the TFL is going to go up for everything when it should just be a helper hip flexor and a helper internal rotator.
Right. And if you stand on that slant board, everything gets undone. It almost feels like you get a little sweaty. It's a little weird for a little while, but you get on that slant board and start to turn on the opposite strand of muscles, the opposite anatomy train.
Yeah, and I've given that to a lot of my telehealth patients, and like they're like, well, my calves aren't tight. I'm like, yeah, but your hips are. And so they can get on there and they may even pass the like knee to wall stretch at 4 to 5 inches, but that's their soleus and their hips are still closed. But when they have to pry those hips open, they're like, whoa, that's just smoke in the back of my knee. In like they have just it's almost like the hardest Contreras hip bridge, them fighting the tension in the front of their hip.
Right. The other one that I've noticed, and this is kind of I wouldn't say taken off as a trend, it's still a smaller trend, the knees over the toes guy, or
Mm-hmm.
people that are trying to like bulletproof their knees, going the opposite way. I mean, I think I saw it with like Chris Johnson, the PT. He has a cylinder block book that came out, but they'll turn around. So they'll go into the high heels position, but they'll kind of do these forward step offs, right? What are those? What are you doing when we flip around on that slant board? What are we trying to figure out there?
So in general, if someone has a problem hip hinging, I put them with heels low because that will encourage that posterior weight shift.
Right.
If someone has problems squatting, I put their heels up. Just because in general, when people have problems with their squat, they're trying to like fit a deadlift into their squat. Like they're too hingy. Like they're trying to really hinge their hips back rather than like squatting, dropping the butt down. And a lot of people don't have the capacity to do that if you don't elevate their heels.
Right. And I mean, I've seen the Pat Davidsons, the Zach Couples
Mm-hmm.
of the worlds do load up some pretty I mean, if you think about it with Olympic shoes, right? You're getting that heel lift. And so they're just amping it up with that slant board.
And I'm doing a ton of that stuff with like my quad tendinopathies, my Osgood Schlotters, and just because a lot of these people have crappy ankles and that's why they have crappy quads, because the quads and calves fire together. So if we can let the quad or let the calf calm down and let them load their knee in a good biomechanical manner and not just consider it a cheat or a Band-Aid it's like, okay, I'm here to load the quad, and I can't wait to load that quad until their ankles move perfectly, or we're going to be here forever.
Right. No, I mean, we had a post earlier this week about dominating quads. Like people talk about, being quad dominant. And I understand that pattern, but I do think the quads are underutilized specifically in rehab. It's a massive muscle group that you can use to, if you can disassociate the quads from the hip flexors, use the quad muscle belly overloading, the knee joint itself. I think some of those, and I think basically that's kind of what you're talking about here, no?
Yeah. And how many people do you see with like grade 3 chondromalacia patella at 35 years old? And you're like, shit, man, I can't do anything for you. Like, we can't do a steroid shot because it's going to run down your freaking leg. And like, there's nothing else wrong with your knee. So you're not going to go get a knee replacement. It's just your knees are going to really make a lot of noise and get hurt until you get a knee replacement in 30 years.
Yeah.
But if you can eliminate a lot of that sloppy lateral movement and glide of the patella by having just a tight rope on it with some good activated quads, to where there's not a lot of messy play in that patella and it's just tight in that groove, like you're not going to have a lot of messy cartilage on the back unless you have a lot of genetic factors.
Yeah, you can't find genetics, but there are ways. I mean, I do think systematically loading up some things, specifically the quads, is a really good practice, especially on that slant board, whether you're squatting heavy on the, like, I know people talk about like, the stacked pelvis over the diaphragm. It's a lot easier to get that pelvis and rib cage kind of lined up, if you will, and then add some load into it. I mean, a lot of times there are these practitioners who they're only trying to align, we'll just use that word, the pelvis and the torso together. The next phase is these kids these days on these slant boards, backwards on these slant boards, heels up, toes down, lining the pelvis and rib cage up, and then putting some weight into their spine.
Yeah. And I think that you're going to have a lot of people that hate on that because they're like, oh, you're rounding. But it's like, hey, if you have a perfectly congruent cylinder to where you have pelvic floor and diaphragm directly opposing each other, you got a neutral spine to slightly posteriorly tilted. It's like people butt wink in the bottom anyways. They're getting a posterior tilt, but then they're bending the paper clip by going into extension anyways. So I think it's safer to do that. And you're just getting the stimulus that you want.
Right. Absolutely. I think that's the stimulus that I wanted for this podcast, to be quite honest. Whether that second round of stimulus checks comes through or not, I have no idea how that's working. Make it rain, making it rain. But no, I really appreciate you coming on today, Nick. Thank you, Severus, for staying quiet. And tell your wife thank you for giving us an hour of your time, man. I really appreciate it. Anything you want to say before we go?
No. Thanks for having me on again, man.
Awesome, man. We're going to have to do it again. Nick, the #1 guest on the Anatomy of Therapy. Thank y'all for listening.
Repeat.